Good afternoon from me too. I'm serving as the chair of Working Group 4, Exploiting the Nucleome in Health and Agriculture. And our new vice chair is Melita, who's also attending. So the idea that we have come up with, because I would like to remind everyone of what has been stressed in the previous working groups and also by Mark in his introduction. The idea of this action is mostly about dissemination and communication. So along these lines, and given the measures that we can implement, our idea was to reach out to biobanks, collections of samples and cohorts, with the aspiration of being able to have a unified strategy, eventually, of samples being stored, organized, and available to researchers for being able to do nucleome type of analysis experiments on them. For example, being able to do a Hi-C experiment, single-cell genomics, bulk genomics, especially things like ATAC-seq that are simple but at the same time require specific handling. So I have here an exemplary map of such biobanks that belong to the German Biobank Alliance, for example, and our biobank now in Göttingen is part of this. And the idea behind this is exemplified in an example I've decided to show today, which has to do with a local initiative. So we have in Göttingen an initiative that is called MOPAC, and this admits about 250 patients with pancreatic adenocarcinomas every year. And what this initiative has been doing up until now is they have been collecting flash freezing biopsies directly from these patients in order to do a number of standardized genetics and molecular biology testing on them. However, this material is very often not compatible with things that we would like to do further on and things that are related to nucleome type of experiment. So what we've managed to do here locally is, and this serves as an example of what we want to achieve now Europe-wide, is to convince them to change the standard operating procedure, which is not a simple task. However, it is a doable task. So the idea is that instead of having people flash freeze material, which we know is limiting, is to make cryopreserved single-cell suspensions out of it, which of course means that someone needs to, tediously go into this and do it. But at the same time, it means that it gives you afterwards the ability to work with that material in a very different way. For example, you can use it to make organoids, like what we do here, and also to do all sorts of genomics. And we see differences. We have done, work on this, which, is not directly funded by the consortium. I don't want to have across the idea that experiments are being paid through this, but definitely the concept that we're trying to communicate can come across. So if you have a cryopreserved versus a flash frozen sample, you lose representation of different cell types, you lose viability, and lots of assays like the single cell assays that I'm showing you here that are relevant to our consortium and to also upcoming actions from the EU. Are problematic. So the idea out of this is to have as many people on board, and this is what our working group is trying to do. We have more than 25 participants from different countries now working with us. And the idea is to reach out to local facilities, local connections, regardless of how small or large they are, and of course biobanks, and convince them that there's enough scope in them changing their SOP. Having a few of them on board will allow us to, first of all, present a white paper on what these new SOP guidelines will be and how you can prepare, store, and handle this biomaterial to facilitate nucleome type analysis, like, for example, the single-cell assays I presented. Then we would have the interested parties participate in a number of roundtable discussions, depending on the number. Hopefully, there's going to be enough of them, such a number that we will need to organize more than one. And then we would discuss the feasibility of these, how we could have exchanges between us, for example, having done it, or other labs that have such expertise, with such people having these collections and cohorts in other countries within the bounds of the INC consortium to be able to transfer these SOPs and hopefully test them. because we do anticipate that there will be some sort of perhaps cell type or tissue type dependency. And in the end, our sort of midterm goal here would be to compile an online repository where these compatible biobanks that are willing, that have done it or are willing to do it, change their SOPs, would be listed there. And the sort of availability that they would have to provide such sort of samples would also be commented upon. And then we would know, again, within the bounds of the consortium, and then respectively the countries, where one could turn when you would like to do these sort of nucleome type genomics on such specimens. So this is more or less the idea and what we're working for, and I'll be happy to answer any questions, of course. Are there plans to reach out to industry actors like biotech companies or pharmaceuticals? That is a good question. To be very honest, we have not directly discussed this. So we were hoping that we would initially try to convince academia and biobanks linked to departments and medical schools, because we would think that they would be more easy and more amenable to what we're trying to suggest. It is not a bad idea. We need to see what the outcome of this first reach out round would be.